Right, welcome everybody. I think we're going to get started. So thank you very much for joining us here today. My name is Sarah Hess and I work with the World Health Organization in Geneva, Switzerland. I'm very pleased to welcome you today to this webinar that we are co-convening with UNICEF and Religions for Peace. This webinar is part of a series of webinars that we are co-developing with our faith partners and with specific focus on communication around the COVID-19 vaccine. I'm going to invite my co-conveners to introduce themselves, and I am going to then hand over to our moderator, Dr. Manoj Kurian. But in the meantime, let me just let you know that we are recording this. We're live streaming it to YouTube as well, so you will be able to see the event there, and I will be able to share the link to the event afterwards. And if you have any questions, we hope to have a time for discussion towards the end. So please do put your questions in the Q&A function on Zoom. So we welcome the discussion. So before any further ado, I'd like to hand over to B from UNICEF. B.
Thank you, Sarah. Good morning and a huge thank you to all of you for joining this continuing series of webinars that's jointly hosted by WHO, UNICEF and RFP. I really want to start off by thanking this wonderful set of panelists who have agreed to share their experiences with us, and of course with a wider audience. We know how important it has been to engage with faith-based communities for the achievement of our joint goals and priorities. Not only are you leaders and voices of influence in your communities, you're helping us in understanding the various nuances when it comes to looking at and understanding the role and impact of FBOs and global and national advocacy for vaccine equity and access, and also the actions that are needed to promote vaccine uptake and overcoming vaccine hesitancy. And so I'm very excited to be part of this joint group and the part of this continued webinar series. And I really hope that, you get to join us as we continue this journey together. I think just one point to say that overcoming barriers to vaccinations for faith communities is not new. We've seen the success in the past in the joint programs that we have conducted around polio vaccinations and on routine immunizations. And the work continues today with what we're doing on the increasing the uptake of COVID vaccines. And just thank you for, continuing to be a part of this conversation, and very much looking forward to your inputs, your questions, and your continued collaboration with us. Thank you. Over to you, Sarah, and then Deepika.
Thanks, B. No, straight to Deepika.
Deepika.
Thank you, B. Thank you, Sarah. Good morning, good afternoon, good evening, all. On behalf of Religions for Peace, I join Sarah and B in welcoming you all. My name is Deepika Singh, and I serve as the Associate Secretary General and Director of Programs at Religions for Peace, which is one of the largest multi-religious movements with presence in 90 countries and 6 regions. When the pandemic struck, Religions for Peace set up a multi-religious humanitarian fund, which has enabled and supported multi-religious response to COVID-19 across the globe. For the last year and a half, our interreligious councils, like many religious institutions and faith-based organizations, have been engaging in offering prayers, hope, and solidarity. But as they raise awareness on preventive measures, combat discrimination and stigma, offer spiritual and psychosocial support, and of course provide much needed basic supplies, particularly to the most vulnerable individuals and communities. Now, along with these, it is most critical that religious communities, religious institutions, and faith-based organizations work with one another and with other sectors of society to secure equitable and easy access to vaccine for all. So, in order to learn from current efforts to overcome barriers to vaccination and scale up and replicate successes, we're most fortunate, like Lee said, to have here with us today outstanding speakers who will share with us their insights, their rich experiences, and the practical work they have been leading in this area. But before we listen to them, let us all observe a moment of silence for those who have lost their lives and for those who have been and are still continuing to be affected by COVID-19. A moment of silence, please. Thank you very much. Over to you, Sarah.
Thanks very much, Deepika. I'm going to hand now to Dr. Manoj Kurian, who's going to do the wonderful job of moderating this webinar today.
Thank you very much, Sarah. Thank you, Deepika, for introducing this context. It's my privilege actually to moderate this session with such a wonderful panel of speakers, who will actually provide us some deep insights into a national and local advocacy and action to promote vaccine uptake and in overcoming vaccine hesitancy. We already know that the faith communities have a very deep influence, but what these speakers will do will give us very deep insights from a local context, and they're leaders in the faith-based initiatives from the world. So first of all, I would like to introduce Andrea Kaufman, who is the Director for Faith and External Engagement at the World Vision. World Vision is a very extensive faith-based organization present in more than 90 countries. Andrea is a global development practitioner who has had the privilege of partnering with local faith communities to solve complex problems for children for over 20 years. She's passionate about bringing sectoral groups together to partner for transformational change. She's worked in a wide range of areas in program management, design, monitoring and evaluation, coalition building, and communications. She will be presenting the World Vision's experience in a 6-country, very innovative 6-country study. Over to you, Andrea.
Thanks, Manoj. It really is a privilege to be with this unique group. I think as Deepika talked about, I think this group, the bringing together of faith leaders, global health practitioners, government and multilateral leaders really has the potential to unlock collaboration that will bring solutions, game-changing solutions for the challenges that we face around vaccine demand, access, and equity. Changes that will help us end the pandemic and its devastating impacts on children. So it's great to be here with you. I believe it's a moral imperative, one that's deeply rooted in my own Christian faith tradition and many of yours, to ensure that people have access both to life-saving vaccines and to accurate, trusted information about those vaccines so that they can make decisions for themselves and their families. And we know that faith leaders are essential for building that community trust. At World Vision, we've seen it for decades as we've walked alongside local faith leaders, teaching us through HIV, Ebola, the challenging questions around sexual and reproductive health and child protection. And we've already seen it as the case in the COVID response. So we have been in informal communication with faith leaders through WhatsApp groups for even before the pandemic. And those became kind of our lifeline to understand and listen to what was happening in communities with our faith partners. And a year ago, we did a survey, and 78% of respondents to that survey, faith leaders, were already actively sharing health information with their communities. They were more than half were combating misinformation about COVID. And as we continue to engage and listen in those dialogues through last kind of summer and into September, October, there was just increased chatter, increased conversation about vaccines, questions about vaccines, concerns, different rumors and things they're coming up in different contexts. And we knew that we really needed to understand the specific kind of drivers and concerns at the community and country level in the places where we worked in order to effectively support faith leaders and communities in their response. And so we used a barrier analysis tool, which is a formative research tool that was pioneered by Tom Davis, our global health lead, in 1990. And it's really designed to help us understand the determinants or kind of the beliefs that drive behaviors, or in this case, a planned behavior of getting the COVID-19 vaccine. And we asked questions of acceptors, people planning to get the vaccine, and non-acceptors, people not planning to get the vaccine, and looked at 12 different determinants that ranged from social norms to beliefs about the efficacy of the vaccine, to beliefs about the severity of COVID, to understand their perceptions about access, and whether or not the positive and negative consequences of the vaccine. And the results really help us understand what are those particular things that are most highly associated with a behavior. And that can ensure that our response addresses barriers and leverages enablers as efficiently and effectively as we can. So we did, as Manoj said, a 6-country survey looking at 3 countries in Africa, Tanzania, Kenya, and DRC, and 3 in Asia, Bangladesh, Myanmar, and India. And what did we learn? Well, we learned a lot, and we're still learning. And I really encourage you to look at the published study to really get into the details by country. But what I'm going to share with you today is just a couple of high-level principles, things that resonated across the study. First, context matters. Now, this is not a surprise. Of course, there are themes across. For example, social norms are very important across all sites, on all locations. However, who the key reference groups, faith leaders, or community members, or family members will differ from context to context. Across 4 of our countries, Bangladesh, Kenya, Tanzania, and DRC, they shared 6 different highly associated determinants. One was the negative perceptions about negative consequences of getting the vaccine. But in Tanzania, one really specific concern kept raising to the top as a prevailing narrative. In DRC and Myanmar, they were really concerned about how severe the side effects were. Perceived benefits also were highly associated, but what those benefits were really varied. In Bangladesh and Myanmar, people were really looking forward to not passing on COVID to others. In Myanmar, lifting travel restrictions was very important. In Tanzania, the ability to return to work and earn money was a huge priority. So context and understanding the context really matters. And the second thing is that faith leaders are essential actors, and they really need to be included in vaccine deployment planning and community engagement activities. In 4 of the 5 locations where questions about faith leaders were asked, 4 of them, between 96 and 100% of acceptors, those planning to get the vaccine, said most of my community leaders and religious leaders would want me to get a COVID-19 vaccine. Across all 5 of those countries, acceptors were also likely to have a relatively high level of trust for the information that was coming from their faith leaders as compared to other groups. Divine will and self-efficacy are categories that faith leaders can and do influence, and they were strongly associated across 4 countries as well. So the role of faith leaders as trusted sources of information in developing and sharing messages through a range of platforms is well established. I think and in some ways relatively simple. But when particular religious, cultural, and ethical questions are the barriers, faith leaders are especially uniquely positioned to cultivate dialogue and discussion on those issues. At World Vision, we've partnered with faith communities using a Channels of Hope module. And what that does is it brings the scientific information together with religious and ethical dialogue. Faith leaders are equipped to first go through some of those questions, unpack them themselves, and then come to their communities with answers and to those difficult ethical and religious questions that may underpin their hesitancy. Ultimately, vaccine demand will only come with trust. And building trust requires faith leaders. It requires listening and responding to the specific questions that people are asking and the concerns that they have. Questions about their health and about the science, of course, but also questions deeply rooted in people's faith, their ethical frameworks, and their cultural beliefs and practices. And so we really all have to do our part to respectfully listen, to answer the questions that people are actually asking, and to address the barriers. Only then, together, can we end the pandemic? Thanks.
Thank you very much, Andrea. It's really encouraging that that you have done, the World Vision has done the study, and it really brings up some encouraging results. I mean, most importantly, we really laud you for listening to the people and discerning what are the barriers. And this is the first lesson. I think we have to listen and understand the barriers. And it's encouraging to see that the faith communities and leaders have such a positive role as well. And the fact that you are mentoring and are connected with these leaders. Thank you very much. I'm sure many questions will be following after this, after the main presentations. The next, I invite Professor Mohamed Karama. We are really privileged to have you, sir, with us. He's a PhD in public health and epidemiology. He is also currently the Vice Chancellor of the Umma University. He has worked with the Ministry of Health in Kenya as a disease surveillance officer, and after which he worked with the Kenya Medical Research Institute, undertaking different research projects on tropical diseases and also teaching at master's and PhD level. And in our context, it's important to note that Professor Karama has been advising the Supreme Council of Kenya Muslims on matters related to health and participated in many faith-based forums. He is a very respected scientist, but also guiding faith communities. Currently, he is the chairman of the National Muslim COVID-19 Response Committee. Over to you, Professor Karama.
Thank you very much, Chairman. Thank you for also the introduction. I want to speak, and I appreciate Andrea's presentation very much. It's very closely associated to what you're going to talk about. First of all, I want to talk about the challenges that we have seen amongst the religious people. The pastors, the imams, and so on, when they read through these conspiracy theories that are there in the social and the mainstream medias, which influences their thinking so much, and that's a big challenge. One of the issues is the loss of total immunity as a result of this immunity against COVID. And then besides that, there are many side effects. And one common one was the clotting of blood and things like that. And then there's no added value. People are suggesting that if we get this COVID vaccine, shall we be now free to remove the masks? Shall we be free not to wash our hands everywhere and so on? Shall we be able now to gather? These are things people are missing. So it's a bit of an issue. And then on the technical side, some of the challenges that have been raised by people is what they hear also from the media, that this vaccine has come very fast, and therefore maybe it has not gone through all the processes of testing and ensuring that it is safe for humans. And these are things that we have to address. And then there's the different variants that are being mentioned now, which are also enhancing stigma, that this one is from India, this one is from UK, this one is from South Africa, this one is, and then you challenge that kind of discriminating against any person from those countries. And we appreciate WHO now is giving references to those variants in a different way. And that is very useful. And the concern also is that these variants, maybe the vaccine that I took or the vaccine that I'm being encouraged in my country will not be useful enough for the other variants that are coming. So these are technical issues that we have to keep on addressing. And looking now at the religious perspective and what we have been able to do is that in the religious aspect is that is this vaccine made from address all faith people, but the Muslims are particularly sensitive. What is this? Is this from some animals that is forbidden? Is it from something like that? So those were the challenges that we are encountering. And then one of the big challenges that we've had is after convincing and sensitizing people, there was the issue of lack of continuity of the supply of the vaccine. So some people got the first dose and then they cannot get the second dose, limited doses. So they're also worried, am I going to lose what I gained from the first dose? Am I going to have this challenge? So these are issues that are rising. But what we have done, we have looked at the faith-based, and we created centers that are friendly to some, kind of Muslims, Christians, for example. Somebody can come with his wife and be separated, and you go this side and the others go that side, and we just don't handle them anyhowly. So we receive them, we usher them in. People get a lot of confidence in that. After sensitizing the people, we had to go around to mosques, and my colleagues from the Christian faith also. We have an interfaith group that we work together to try and talk to people about the importance of vaccine. And we have used the consequences that have been noted in our community. For example, there has been increased pregnancies, there has been increased gender-based violence as a result of this. The leaders accepting that there are frontliners, they need to be vaccinated, they interact with people, they are much more close to the people, and to prevent them, to protect themselves and protect others, they needed to be vaccinated. And then we also used religious centers such as churches and mosques, especially mosques, as centers for vaccination. And this has worked very well. People think that if they get vaccinated in such a place, maybe it is much more comfortable to them, and so on. And therefore, this sensitization, we have used different scriptures which encourage that the maintenance of health, the sustaining of health, good health, the prevention of diseases is crucial even in the religious teaching. And therefore we have succeeded quite a lot in the small amount of vaccines that have been received in some countries. And we know that Africa is now moving towards trying to adapt the technology so that they can also be able to make their own vaccine. We relied on India, for example. India now has a problem, so they are consuming their own products, and there is little chance of other people getting. And we are, I think, as a community, COVAX, as the institution that is looking at distribution, needs to really, we are pushing them to consider the countries that may not be able to do so much. And therefore, I want to really feel like, I want to agree that the faith-based, we have succeeded a lot where other institutions could not. And we are doing well. If we can get adequate vaccines, we have been able to get people to overcome some of the barriers that have been a hindrance and creating hesitancy towards accepting the vaccine. So I really thank the UNICEF and the WHO for working out on this program so that we can inform the people that the faith-based are really front runners in this, and they have a big role to play, and we shall continue. And we need whatever support that we can get, the goodwill from the government, the goodwill from the people. This will enhance our participation, and God willing, we will be able to overcome this pandemic of COVID-19. Thank you very much, Mr. Chairman.
Thank you very much, Professor Karama. It is amazing how you have brought building on Andrea's presentation, you have actually brought forward that you and the faith community where you support are not avoiding the challenges. You are actually addressing the challenges, the conspiratory theories, the lack of understanding, and you, with great sensitivity, you have addressed these issues in their own context and social and the belief systems. But what is important is that we also see that you being such a qualified and a well-known scientist are able to, along with the faith communities, able to sensitize people and educate in an interfaith manner, and also strengthening the faith communities to be centers of vaccination and working closely with science and with faith. Thank you so much for this presentation, and we will receive questions, of course, after this session. I would like now go to the next speaker. Dr. Inon Senka is a global health specialist working in the faith-based pandemic mitigation intervention for over 20 years. In HIV, he represented the Jewish voice of the UNAIDS faith initiatives and later worked with Catholic schools in Latin America, in Latin America and in the Philippines. He was he also brought in very important collaboration between Jewish and Muslim communities called the Operation Abraham, scaling up voluntary male medical circumcision in Africa. In the COVID-19 emergency, Dr. Inon is part of the Israeli-focused response to the Jewish ultra-Orthodox population, and is managing the Color Green Vaccination Initiative, supporting faith-based organization in the COVAX priority countries. Welcome, Dr. Inon. Over to you.
Thank you so much for the invitation to be part of this very important webinar, and thank you, Dr. Koyan, for the introduction. I decided to share some slides, as I think that pictures and short videos sometimes speak effectively to the many words of encouragement that we have also received from the other speakers. Humbly, I would say that I believe that the challenge of meeting the goal of the COVAX effort on disseminating and deploying so many vaccines around the world is far-reaching from the equitable distribution of vaccines by COVAX. In our opinion, country preparedness and deployment mechanisms will require participation in synergy of many in-country health providers, including faith-based organizations. So it is a pleasure to inform of a new initiative launched this month, which will support international collaboration among faith-based health providers, similar to the best practice from HIV and from Ebola, as we have seen in recent years. Color Green Vaccination Initiative is focusing on COVAX prioritized countries. It is aimed at tailoring experience in massive COVID-19 vaccination deployment and in addressing hesitancy by relying on health leadership in health and in communication. From a Jewish perspective, I would like to emphasize in regards to our webinar theme that Jewish religious communities around the world are no different from other faiths, both in barriers and in the search for solutions. However, in overcoming barriers to vaccine uptake and hesitancy, certain Jewish commands and communal behaviors needed to be addressed in Israel and beyond. And I will share with you some of the challenges and the difficulties. All must be kosher is not a slogan. It is a rule for life in the Jewish faith. For centuries, Jews have only obeyed rulings of religious authorities acceptable to them on almost every part of their lives. Two examples: from milk to toothpaste and toilet paper, baby formulas, ice cream, meat, or leather fabric. If not stamped kosher, it is out. So the supervision and approvals of religious entities has been superior in ultra-Orthodox Jewish communities to almost everything else. Thus, when the US CDC directs 2 meters distancing and the rabbi says wedding comes first, Brooklyn had seen this. Conflicts such that I've shown in this very short video could sometimes be mitigated if there is a public health and faith dialogue. So the question is, what could we learn from countries that have a majority of their population Jewish? And that is actually the Holy Land. Israel is presenting a unique case study. First, because it is the homeland of the Jewish people. Second, because it is the first to reach herd immunity through vaccinating close to 80% of its adult population. And thirdly, because it is located on the crossroads between Asia, Europe, and Africa. But when 31% of Jews in Israel prioritize religious directives in their daily lives, it has been very clear that without them getting vaccinated, public health will fail. So convincing scientific and medical argumentations, or even hundreds of funerals of relatives or friends succumb to COVID, could not help mobilizing ultra-Orthodox Jews in Israel to get vaccinated. God has given and God has taken. May the name of God be blessed, they would say. The key was then cooperation with religious leaders, super influencers, who could in a whisper mobilize hundreds of thousands to be vaccinated. And so I would like to share with you some of the responses, practical responses that have now become best practice. What is now considered best practice are focused interventions that targeted the diverse Jewish communities and their levels of religiosity, all in parallel to the orchestrated national deployment campaign in the country. The close relationship between the Jewish communities in Israel and in the diaspora allowed for several successful experiences to be exported. So let me share with you some examples. On the left, we can see that a unique Orthodox desk was set up at the Ministry of Health National Control Room with senior members of the faith-based community in order to support messages and influences. Vaccination centers, which you can see on the central and lower part of the slide, have actually accommodated and are sensitive to faith considerations. For example, females are injected by females. And in the picture, you can actually see a Muslim nurse vaccinating a Jewish ultra-Orthodox woman, males vaccinated by males. On the left side, in the bottom part, billboards where rabbis have approached directly their communities and their followers in order to encourage them to be vaccinated. And a most recent book of halachic and medical argumentation for scholars. Further few examples. The chief Sephardic rabbi instructing, for the first time we have heard that, followers to listen to what doctors say and get vaccinated. Have a look.
לפי ההלכה, אם שואלים מה ההלכה אומרת, כל שההלכה, אין פה הלכה. ההלכה מה אומרת? כן, כל אחד ואחד צריך להתחסן עם מה שאומרים הרופאים.
Listen to the doctors and go vaccinated. A chief rabbi, the Sephardic rabbi in Israel, appeals, as you can see in Hebrew, but the message is clear, of rabbis that have co-signed petitions and appeals of those influential rabbis to go vaccinated have been widely distributed. Peshkvils on the left side are public billboards of internal importance within the religious communities. This is the major means of communication there, where television and other means of modern technology are not available or respected. So these personal stories to reduce hesitancy have went on this internal type of communication, as well as other related letters, specifically encouraging teachers and school staff and students of the upper grades to be vaccinated. And lastly, I would like to share with you some of these solutions, which have been impacting now millions of Jews around the world that have been exported to Jewish communities. So 90-year-old and 100-year-old Holocaust survivors have also been tapped to support the vaccination campaigns. I hope we can have a listen.
I'm very happy that they organize it so beautifully to protect us. And I'm not worried about it hurting. Okay.
I'm looking forward to get the second shot because I want to be able to go to the dining room and eat. 11 months I've been eating by myself. Forward, and my son wants to make, you know what a Seder is, you know, my grandchildren. That's what I'm looking forward to see them with their wives, you know.
Yes, I understand that we had a technical problem with the video. So just to share as I close up, a special hackathon trying to solicit special innovation around infodemic and the blockchain support by a technology, as well as special blessings that have been developed in order to encourage the individual participation in the vaccination campaigns. And also, unfortunately, I cannot show the video, but the pizza and food have been a way of support. So different communities, Jewish communities, have actually tapped into the food industry and provided pizzas for those who have received the vaccination. In conclusion, faith-based organizations have been in the front line of healthcare for many years, and COVID-19 vaccination deployment is another opportunity for global collaboration. COVAX could achieve, we believe, its goals faster when engaging with faith-based health providers and to get vaccines effectively from the port to the arm. Jewish organizations add value to this mission, which is aligned with our Tikkun Olam, repairing the world value of social justice. Thank you so much.
Thank you very much, Dr. Onaiyekan. It's a very, very strong input in line with the earlier presentations. It's amazing to see how you have been working with leaders and listening to them and also taking in the voice and mobilizing the voice of opinion leaders, of Holocaust survivors, of people who have survived difficulties. And of course, your strategy of using multiple strategies, both specific and national, and rolling it out with sensitivity and also respecting other faiths. Thank you so much for your presentation. Now we go to the next intervention. Sister Agatha Chikelue is a Catholic sister from the Congregation of the Daughters of Mother Mary of Mercy, who is an executive director of the Cardinal Onaiyekan Foundation for Peace, which has a mandate to provide the platform for interfaith dialogue and actions for coexistence in Nigeria and wider Africa. Sister Agatha currently serves as the chair of the Religions for Peace International Women's Coordinating Committee, which provides leadership for global women in faith networks. She is also a co-chair of the Religions for Peace in Nigeria of the Faith Interfaith Networks. She is highly qualified and has doing a PhD, but a lot of masters and degrees, etc. But most importantly, she brings in all her wisdom to promote interfaith harmony with her interventions in her community. Welcome, Sister Agatha.
Thank you, the moderator. Thank you, the organizers, for bringing me here for this important program, this August program in June. Thank you, viewers. Our own situation and case, my country of focus is, of course, Nigeria, my country where I'm residing, where I live. When it comes to COVID-19 interventions, and especially in the area of vaccine, it is not still very, very smooth and easy. It is not still a welcome development to a lot of masses, especially those at the grassroots level. There is still this big issue of a lot of fake stories going around, myths as usual, where people keep discouraging each other on the reason why they shouldn't go for the vaccine. It is also so high here in Nigeria that a lot of people are not really willing to go for vaccine. In fact, to start with is that some people do not even believe that the COVID-19 is real, let alone going for the vaccine, because it is when you believe, when you accept that maybe you are sick, that you have to go and see a doctor. But when you think that you are fine, everything is okay, you have no need for a doctor. So that is just one of the key issues and challenge we are facing here, is that some people still believe, both Christians and Muslims. No, as a Christian, I don't believe it. This is the sickness of the white. This is the sickness of the unbelievers. It doesn't exist, those blah, blah, blah. So it is still high in the community. And then eventually, for very few who are beginning to, accept the fact that COVID-19 does exist, another fake story, another angle of the fake story, started creeping in, even from the angle of the religious leaders. And when I talk about religious leaders and institutions, I'm speaking for even the Christians and Muslims in the country. We have gotten some clerics who have told their members, bluntly, don't you ever try that, don't take the vaccine, don't go, it's not from God, it is this, it is that, So we have some few religious leaders who have been discouraging their followers from taking the vaccine. And also some who maybe, even if they don't believe in it, they will not encourage their followers, their members, to go for the vaccine, to take the vaccine. So that is some of the challenges we are having. The fake story is still so high that now that a lot of people are beginning to understand that COVID-19 is real. Another big fake issue, big fake news is that they are being discouraged with what they send around on media, or social media, especially the WhatsApp. In Nigeria, WhatsApp is so high. In fact, as I'm talking to you in this very program, about 5-10 minutes ago, my own aunt sent me a WhatsApp link that with a link by one Nobel Peace awardee, maybe I don't know the year actually, who was encouraging people never to go and take vaccine, because those who took the vaccine will not live more than 2 years, they will die. I just got that. It's in my WhatsApp now a few minutes ago, and I saw it, I laughed, and I know I will still reply my aunt letter and beg her to stop circulating fake news, because that is fake. It is not real. So what are we doing? The religious people, to overcome the barrier. A lot of us who believe in it are also championing it, both from the Christian side and from the Muslim side. You go to the mosque on Fridays, they keep encouraging their members, go and take it. Ignorance is no longer an excuse. Go and take it. The COVID-19 is real. And to make it much easier, some churches is serving now as a center for receiving COVID-19 vaccine, like in our own cathedral here in Abuja. On Sundays, during masses, it will be announced, after mass, please queue up and take your vaccine. We have the team here with us. So, and likewise in the mosque. So that's one of the ways to promote and to encourage our people to go for that. And also to go further on that, I know vividly that our own Cardinal, he has already taken his vaccine, and he did that, just to encourage others. Likewise, the Archbishop here, likewise the Imam in the mosque, they have all taken. And most of the time, they do this, with media covering the exercise, the gesture to encourage the faithful, to encourage people that this is real and that all of us needs the vaccine. From my own side, women, we always come last most of the time because we tend to believe anything for some of us. So I have been talking to our members, I mean the interfaith women, the Women of Faith Network, leaders from different states on the need to inform their members, sensitize their members to go and take the vaccine. I do that from time to time on the WhatsApp page. I will send little clip encouraging them to go and take that, and some will respond. And also, in our own convent too, I do encourage my sisters to do that. And as a way of showing them example, because I can see the fear in so many of us about this vaccine. I decided to be the very first to take it. So the day I want to take it, I told all the sisters in the convent. I came to the office because as at last month, none of my staff was able to take it. So I decided I'm going to be the first. That before ever I would tell anybody to go and take your COVID-19 test, I should be the first to take, so that at least they will see that I have taken it and that I am fine. So, and that was exactly what I did. I went and took it and told the sisters, look, I have taken it. I showed them my card, came to the office and I told them I have taken it. I showed them my card and I asked them, please, in as much as we are not going to mandate anybody to take it, I encourage you to please take it for your own good and for the good of everybody in the society. So that is a little we are doing to ensure, to promote, to sensitize, and to encourage our people to take it. And then another issue, which some of the speakers have already pointed out, is that the inadequacy of the vaccine, the stock in our country. Because I remember vividly that we don't have enough stock here in Nigeria, going by our population, which is approximately 200 million. And my question to them, the very day I went to take my own vaccine, is this. I asked the nurse who was attending to me, I said, okay, now that we don't have enough, and because not many now, but some of our people are afraid of coming to take vaccine, do you think we are going to have enough when many people are convinced and they are out to take the vaccine? What are we going to do? And she spoke to me and said, sister, that will be the biggest challenge, because we will not have vaccines to attend to them. So we don't have the stock and we don't know how to go about it. So just as the last speaker and the previous speaker said, if we will have a means of, or maybe government, the World Health Organizations, and then the UN and the rest, they will find ways of supporting Africans, in getting more of these vaccine, and other countries, in getting this vaccine. That will really help, because I know that surely people will come to realize the importance of taking the vaccine, and people will go for it. And it will be so disappointing that when eventually they accept to take the vaccine will be nowhere to be found. So I think that's my little intervention on this. COVID-19 is there, and the people are doing whatever they can to ensure that they take the vaccine, which ensures our safety, the safety of the entire humanity. Thank you very much.
Thank you very much, Sister Agatha. I think it's amazing that you are addressing these challenges in the social media head on. You are physically there, responding to these challenges, and then you're visibly responding, taking leadership, working with other faith leaders, and practically bringing about change, and at the same time addressing issues of access. Thank you so much. We are really indebted to all of these wonderful interventions from our leaders. Now we have to, time is against us. We have a few questions, so I will be raising these questions to you, but I really request our resource persons to address them very briefly. The first question that came from the audience is from the participants is that there is an increasing evidence on the important role and impact of faith leaders and institutions in health and development. Why are we still not bringing them to the table of decision-making, policy and program development and implementation, particularly in Africa? Over to you.
Okay, maybe I am the last speaker now, so let me be the first on this. I would actually say that, that question would have been better asked to our leaders, politicians, government, because we as the religious leaders may not be in the better position to answer that, because I don't know their reasons for sidelining us, the religious leaders, the faith communities, in decision taking. So maybe they would be in the better position to tell us their reasons for not, seeing us as part of people that the policies will affect their lives and the community. Thank you.
And Andrea? Andrea?
Sure, yeah, I mean, I just echo Sister Agatha. I think it's hard for us to answer that question, but I think we do have an opportunity to continue to tell the story of that evidence and engage with our leaders and politicians and decision makers to show how we can together create more effective deployment plans, vaccine plans at the country and the local level. Thanks.
Professor Karama?
Thank you, Chairman. I think in many countries now, governments are appreciating the role of the faith-based. Typical example where we are, an interfaith group is part of the decision-making and advising the government, especially in relation to the lockdowns and the curfews and whatever. And therefore, the church is playing quite a bit of a role. Sister Agatha, I think what she said is maybe ask the politicians. The politicians will not accept anybody to oversee them, but I think the faith-based can even provide an oversight into the government and the politicians. Sometimes the misconduct they do, especially in addressing the needs of the.
Thank you, Professor. Dr. Inon?
Very briefly, I would actually tap to my experience in Latin America, mostly Catholic countries in the Philippines, and say that politicians basically would also like to see positive results for the public, for the people. So always there is what's in it for me. And I think that when the relationship between faith leaders in a particular country or a region makes sense in terms of achieving national goals, and health is an important one, that would work. As I've said in my short presentation, if we had not been able to reach the ultra-Orthodox Jewish community, public health would have failed. And public health is a national effort, a government effort, secular and religious as well. So finding the pathways, finding the right motivations and interests, respecting each other, each side of the table to be one table, I think is very compelling.
Thank you so much. The second question is a short one. Please address it very briefly. How to introduce science into population in the context of religion? It's a big question, but try to address it. Professor Karama? How to introduce science into population in the context of religion?
Thank you very much. Many religions actually are now teaching science. The scriptures, there's a lot of information that is becoming alive when we encounter some of these challenges. Many things are in the scriptures, the managing of health, the managing of refugees and so on. I think people should go back to the books, to the scriptures, and see how much science is in religion, and try to adapt that. And combining it with the current development in science, it is to convince religious leaders that science is there by the will of God to help the people, not to be against the people. So they also have to accept the development in technology and also in other sectors in the science. I think this is important to merge the relationship between religion and science. Thank you.
Sister Agatha, what is your take on this?
I don't know. Please, you really have to excuse me, because I was thinking that the question was for the first speaker, so I didn't really quite pay much attention to
Okay, no, it's about how to introduce science into the population in the context of religion.
How do we
introduce science into the population in the context of religion? Science.
Okay. Yeah, science can be introduced in the context of religion, from different angles, at least starting from what we see, starting from the simple analysis. For instance, I have headache, I pray. That is the spiritual aspect of it. Then I go and take my medicine, and that is what my faith teaches. So applying it is talking about faith and work. So now with the faith, I have prayed that the sickness will go. Then my work is to take the medication, which was produced by science. So both are marrying together, both goes hand in hand. And mind you that even the scientists, it is God that gives them the wisdom, to do what they are doing, to bring out the vaccines that we are going in for and the rest of them. So when we understand it that way, then it will help us in the work we do.
Thank you so much for your wisdom, Agatha. Andrea, your thoughts, please.
Yeah, I would say one of the things that we have been actually building a body of evidence around is the way that we should be bringing together the scientific information and the faith and kind of ethical questions in a dialogue-based approach. We need both. I think in most cases, religion and science are complementary. They support each other, they reinforce each other, and we just need to ensure that we're having that communication with our faith leaders and faith communities about both. And I think we find the outcomes are we can work through the questions that people have, whether they're based in science or they're based in faith. And it's important to be willing and able to talk about both.
Thank you very much, Andrea. And Dr. Inon, the last word?
So if we believe in the ultimate God as the creator of the world, obviously God has created not just rabbis and qadis and priests and cardinals, but also scientists and other healers, including medical people. So I think that in that world, perhaps avoiding the conflict points between science, Darwinism, for example, and faith in many areas, and sticking to where it really is helpful. So scientists do not need to teach, faith leaders about science, but they need to come together to see, as Sister Agatha was suggesting before, and Andrea for sure, including my colleague Mohammad, on the benefits that medicine, that health could bring to the healing, to the continued of life by communities that have strength in religion. And I think that we can tap to many examples where actually the help of, if you want, medical sciences or health sciences, public health, have supported religious leaders in the joint and common interest of preserving life and good health.
Thank you so much. I mean, there are many more questions, but what we can assure you is that we have documented these questions. We will find a way to answer these questions and put it up in a way where you can access them. And we will have this webinar has been split into two, and we will be having a following webinar next week for more examples. Now, I beg your indulgence for 5 more minutes because we need to summarize these things. And this wonderful discussion and that has come up during this webinar. And I request Dan Irwin, who is my co-moderator, to come forward and to give us a summary and some reflections on this webinar. Over to you, Dan.
Thank you very much, Manoj, and thank you so much to all of the panelists for this really wonderful examination of the intersection of religion and science, as it's been phrased in the latter questions. Sorry that we're running out of time. I'll try to be poetic in my summary. I heard at the level of objectives and why we are having this discussion, issues primarily around the development of trust, trust in communities, in the vaccines that are coming out, and the need for accurate information and for countering the misinformation that is being propagated out there as well. And these all to address vaccine hesitancy issues, and also to address, very importantly, the issue of equity. And this all comes together as a moral imperative for religious and faith actors. They look at it from a moral sense. And I really appreciated Deepika's note at the beginning of the session also on the need to cultivate hope. So that's at the level of objective. Then the panelists were sharing so many fascinating actions and activities, interventions that they've been engaged with. Firstly, the importance of engaging faith leaders and listening to them with respect, listening to populations respectfully, and responding to the issues that they raise in their context. And the notion of context was pointed to as being very important also, because the hesitancy issues or the barriers to equity and vaccine uptake are not necessarily homogeneous across the world, but take on different characteristics in different countries and places where we work. The importance of cultivating dialogue between religious communities and science communities and political communities, but the dialogue being very important. Then there was citation of the important use of scripture when working with religious leaders and people of faith, and finding the intersections of science and the medical recommendations with the fundaments of religious tenets based in those scriptures. There was the citation of the important use of religious centers for vaccination as being places that encourage trust in populations, and those religious centers also channeling important supplies during the pandemic response. Somebody noted that this is not new to the COVID pandemic, but in fact, that faith-based organizations have been providing public health services historically for a very long time. I'd like to note that there was a lot of emphasis on collaboration between faith leaders and health leaders, very important, that faith leaders were noted as being important champions and influencers in this public health challenge, and that they can model best behaviors and practices, such as Sister Agatha's example of publicly getting the vaccination and sharing with her colleagues that she's gotten it. So there was much more, but as we're at time, let me stop with those points. And maybe just to point out one of the participants, Bin Gao's great question that you used also, Manoj, on how to introduce science into a population in the context of religion. I think that summed it up very nicely, Bin. Thank you for that question and framing. Thank you, everybody.
Dan Irwin, the Senior Director of Health and Nutrition, World Vision International. I hand over the floor to Sarah Hess, Dr. Sarah Hess.
Thank you very much, Manoj and Dan, and all the panelists and presenters. It's been a really wonderful session, and I'm sad to see it come to an end. But just to tell our listeners that we will have part 2, as Dr. Kurian said, next week on June the 17th. And I will be sending out an invitation to that towards the end of this week. So do watch out for that. Alex has put into the chat the link to be able to subscribe to the EPI-WIN mailing list so that you can receive that. And there's really nothing more to say, but thank you to everybody for joining us today. And thank you once again to our very inspiring speakers and presenters. It's been a real pleasure to have you here today. So thank you, Manoj, for your great moderation as well. Take care, everybody, and I wish you a good rest of the week.
Thank you.
Thank you, Manoj. Thank you, Sarah.
Thank you. Bye.